Hey guys, this is Dr. Jean-Guy, and today I would like to talk to you about this subject called chronic pain. Why do I want to talk to you about chronic pain? Well, it's pretty simple. There's like millions of people in this country that are dealing with chronic pain of some sorts, whether it's musculoskeletal pain or other types of pain. And one of the things that I've heard over the years is, Dr. Jean-Guy, I have this pain and there's nothing that can be done. Or they will give me this laundry list of the things that people have done, and they'll be like, I've tried everything. I have tried everything. And I'm like, okay, that's good. Well, if this is you out there right now, I just want you to pay attention, because maybe you haven't tried everything. And I want to just kind of maybe bring you some new ideas that might help you to just kind of maybe change your mind, maybe try something new, maybe something you haven't heard before. Because you know what, being in chronic pain every day, that's really debilitating. And we also know that when people have chronic pain, they're more likely to have depression. And if this is you out there, I feel for you, because I have seen many through my career in 25 years that are dealing with those issues. So let me give you a little bit of insight and solution, not just the problem here, because obviously we know what the problem is people have chronic pain. And if this is you out there, you're like, it feels like I've done everything. So let's just say here that if you have any sorts of pain whatsoever, a normal person, for most people, their pain threshold, let's pretend here it's from here to here. And when people start having chronic pain, their pain threshold is more like that. Meaning that it takes less for them to get to the point of pain, or they're in constant pain, not knowing why, and then again have tried everything. So the first thing that I tell people, and I'm like, listen, the best thing that you can do for chronic pain is you need to move. Why is that? Because in your joints, there's this thing called mechanoreceptors. And I know that's a big word, but those mechanoreceptors, what they do is they tell you where you are in time and space. And the mechanoreceptors will inhibit the nociceptors in your brain. So what in the world does that mean? It means that they cancel each other out. So what you need to do, if a person has chronic pain, the best thing that you can do is you need to just keep moving. Because motion is life. And when you stimulate mechanoreceptors in your joints, then what happens is you will cancel the nociceptors. And the nociceptors are the pain guys. So the more you move, the better you are. Now let me tie this in now. We're talking about exercise. We're talking about moving. We're talking about on a daily basis. And then number two is, now I want to be more specific, is did you know that in your spine, the joints that have the greatest impact, that have the greatest number of mechanoreceptors per square inch, is in your upper cervical area. So what that means is the upper cervical area, the top two bones called the atlas, the axis, if you did not know. And of course, me as a chiropractor, I know a lot about it. And what I'll say to you is, if your spine has any kind of misalignment because of stress or injuries or falls, or what you do for a living, sitting 8 hours a day, 5 days a week, for the past 20, 30 years, if those joints are not moving properly and they're stuck, those are the ones that have the greatest impact on, for you, the ability to feel and perceive the pain. So we have seen, I have seen thousands of people in my 25-year career that we've been able to help with pain. That's the reason why chiropractic is so amazing for people that have pain. Obviously, there's other things chiropractic is good for, but as it relates to pain, that's one of the reasons, is you're stimulating mechanoreceptors, which will inhibit the nociceptors in the brain. As a result of that, people feel better. And then voila. At the University of Pittsburgh, they took some people, they were about to go have surgery because they had back pain, and they took half the group. And the other half of the group is, they're like, hey, you guys, what you're going to do is, now I'm just going on a different subject now, right? Because I want to give you this last part. And the last part is, so they took those two groups, they split them in half. One half, they need to have surgery. Then the other half, they're like, hey, you guys, you're only going to take fish oil. And you can still continue taking your anti-inflammatory, but now you're going to take fish oil. So So they did that for 90 days, 3 months. And after 3 months, in the upward of 80% of those people that were started to take fish oil, they stopped taking all their pain pills. So what's the moral of the story? The moral of the story is fish oil, EPA and DHA specifically, EPA and DHA, specifically in the fish oil, not any kinds of fish oil. And in those studies, they were taking at least anywhere between 5 to 8 grams, which is 8,000 milligrams of EPA and DHA, in order to get those kinds of results. And the type of fish oil, if you're wondering right now, and I just want to give you a quick insight, I did other videos on that, but you got to make sure that it's pharmaceutical grade and or molecular distill, meaning that it's quality fish oil. There's a reason why some fish oil is at $5, some fish oil is at $60, because of the quality and concentration. So those were the tip of the day today for chronic pain. How can you get some help? Maybe you just did not know that you moving is important. And then number 2 is to have your spine checked, have your spine evaluated chiropractically. And then if there's any kind of damage to your spine and nervous system, and you have any kind of spinal damage, especially in the top area of your spine, we call that subluxation. That should be addressed. And then number 2 is if you're not taking fish oil, you should do that every day. And you should take a lot of it. So hopefully this was helpful to you. We'll talk to you soon. Take care.